Hello everyone, welcome back to another video. In today's video, we are going to talk about the X-ray registry review for patient care. This is part 2. We are going to cover legal issues. I do have part 1. I will try to remember to put it at the end of this video for you to click on. And I will also put the link to the playlist, my X-ray review playlist, in the description box. For the patient care section, there will be about 33 questions. For this video, we'll talk about legal issues. It will cover verification, which is verifying your patient identification, compare the order to the clinical indication. We'll talk about common terminology such as battery, negligence, malpractice, beneficence. We'll also talk about legal doctrines, respondeat, superior, res ispa, loquitur. We'll also talk about restraints versus positioning aids used to eliminate motion artifact. We'll talk about manipulation of electronic data, which is exposure to indicator, processing algorithm, brightness and contrast, cropping or masking off anatomy. And then we'll talk about documentation, which is the changes to order or medical event. This is the ARRT outline. I am following the ARRT content specification since I do have my X-ray certification or radiology technologist through them. So on their exam, it's going to be about 33 questions under patient care. We are still talking about patient care. This is part 2. And then if you look down here, there will be 30 unscored pilot questions, meaning questions that is not counted for, but it still will be asked. So just make sure you know everything. I try to tell people, even though patient care seems to be the easiest to some, do not skip over because it can be the hardest as well if you do not study for it. Altogether, there will be 200 questions on the test, and then those 30 unscored pilot questions, so 230 questions. So we'll start with verification. You must verify that you do have the correct patient. You'll do this by checking their name, their birthday, their order, match it up to their wristband, and also make sure that the exam order reflects what the patient's complaint is. So if the doctor put in a foot x-ray, make sure you do not x-ray ankle. Or if you do x-ray the ankle, is the patient having a problem with their ankle? Did you reach out to the doctor to see if they can change it to the correct order? Compare the order to what the patient is stating their problem is. If order is incorrect, reach out to the radiologist for a clarification, or you can reach out to the ordering physician. A lot of times, if it's like an outpatient order, sometimes, not always, you may have like a phone delay with getting in touch with a nurse or a physician, but you can always reach out to the ordering physician. If the patients are not able to verbalize their name and date of birth, check their wristband, check their ticket to ride paper. If you are working in a hospital, a lot of times the transporter or the nurse would print out a paper, and it's like a ticket to ride for them to take with them, and it goes over what they're in for, their name, their bed number. It has like their blood pressure and vital signs on there. You can also verify this information with a family member. If a family member come down, or a nurse, sometimes depending on where you work at, the patient may have a picture in their chart. You can't always trust that, but um, that's another way you can match their name and birthday up with the wrist and then also the picture. Do not trust what the order states whenever it comes to taking an x-ray. You always have to double check and make sure that you are doing the correct exam. Always verify that you have the correct side and the correct body part that you are looking at. And orders can be placed incorrectly. I've had this happen to me like a few times working in MRI because I am an MRI technologist. So there are times where I had a patient schedule and it was the wrong exam or wrong body part. So these do happen probably not as often, but it can happen. Now we have legal terms that we will talk about. You have battery, which is an unlawful touching. You'll be touching someone without their consent, such as taking x-rays on the wrong patient or the wrong body part. Forcing a patient against their will to have an x-ray is a sign of battery. And then you have negligence. This is neglecting or not performing care to patients, not assisting patients to the restroom if they are a fall risk patient, not performing x-ray exams in a timely manner. If the doctor just ordered 5 x-rays on this patient and they ordered 2 other x-rays, let's say 5 minutes ago, now you are delaying the patient care because you're like, oh, the doctor just put this order in. Why they didn't put it in when I was down there? That's neglecting the patient care. And then you also have lack of communication with your patients. Now we have malpractice, which is when a healthcare professional breaches their duty of care. This leads to harm or injury to a client or patient. So, how can someone prove a malpractice case? Was the standard of care violated by the radiology technologist? Was there a loss or injury caused by the rad tech? We have false imprisonment. This is holding someone against their will. A tech or healthcare provider or personnel holds down a patient that is refusing an x-ray, even though the patient need the x-ray, but if they are like mentally altered or if they do not want to pay the hospital bill or if they just ready to go, and you're holding them down for the x-ray, you're holding them against their will because they're telling you they do not want it, or maybe they showing signs that they do not want you to be around them. That's false imprisonment. Also, a healthcare provider or personnel that tells a patient they cannot be discharged from the hospital if they do not perform the x-ray examination. That's false imprisonment. I know a lot of times when I'm working, sometimes a patient leave, they say AMA against medical. So a lot of people will leave like that. They probably decide that the wait time is too long or they do not want to pay the bill. It can be many reasons why patients leave, so just keep that in mind. You also have invasion of privacy. This is touching someone inappropriately without their permission. An unauthorized disclosure or use of a patient's or medical information without their consent. So, say for example, you work with a coworker and they come in for an x-ray of their chest or an x-ray of their abdomen, and you are so curious to know why they're in the hospital. What other things do they have in their medical chart? That is invasion of privacy, because what if you're not the tech or you're not the nurse or doctor that is taking care of this patient? So that is one of the reasons why some people or employees will put like a lock on their chart, and you will have to break the glass, and whenever you try to get into their chart, it's going to ask you like type in your username or your password to get into the patient's chart, and it's going to ask you, okay, why are you in this patient's chart? A lot of times when I have to break the glass on patients, I always put because direct patient care, because I'm taking like their x-ray, their mammogram, it's some form of patient care. That's why I'm in their chart. And then you have libel versus slander. These are terms that a lot of people get confused. So hopefully this explains it in a like an easy way for you. So for libel, that's whenever someone is writing information that is defaming someone's character or causes someone to lose their reputation. So if someone is texting you or emailing you saying, hey, I'm working with, and I'm just using like fake names. These aren't anybody I know, but you can say, hey, I'm working with Jane today, and later on you're working with Joe. Do you know that Joe do not like getting up for portable x-rays, or Joe do not like to do fluoro. Be careful because he's lazy. He's not going to want to work, and you are going to be doing all of the work. So that is liable, because you're texting this person, like giving them a heads up that they are working with someone that is quote unquote lazy. So be mindful that you are going to work whenever you come in. So that would be like an example of libel, because it's either written down or it's like through text. And then you can also send it in an email. You can write it down on a sheet of paper, pass it to someone, or leave the note for someone. If you're like doing it in a malicious way where you're gossiping about somebody. And then we also have slander. So this is orally spreading false information about someone that results in you defaming their character or causing them to lose their reputation. So you're actually speaking to someone kind of like how I'm speaking now, but you're speaking to another person, with your words, telling them, hey, such and such, they're always late. You're saying something malicious, nothing positive about someone. You're just spreading false information. What if they're not always late? What if they're on time, but because they're not 10, 15 minutes early, you think they're late? Or if you're saying that they like to take smoke breaks a lot and they don't take smoke breaks, that's spreading false information. All right, now we have more confusing terms to remember. We'll talk about beneficence. That is acting in the patient's best interest and promoting their well-being. So you're trying to do something good for the patient. This is optimizing the imaging protocols to minimize radiation to the patient. Do you have the correct and appropriate KVP and mass set is pulled up for the patient or the body part being imaged, especially if it's a pediatric patient? Did you remember to change the protocol from adult to pediatric? Then you also have you're providing clear instructions to the patient. You're communicating with them to let them know how long the exam will be, how long to expect their results. So that would be an example of that. Then you have non-maleficence. This is avoiding harm to the patient. This means to do no harm, avoiding overexposing patients with radiation by selecting the correct KVP and mass parameters. You're also making sure that you are not performing an abdomen x-ray on a patient that is pregnant. Reach out to the radiologist and ordering physician for clarification, just in case an order was put in. Maybe it was put in incorrectly. Maybe it was put in on the wrong patient. Maybe it was put in and no one paid attention that the patient was pregnant. And if it is put in, what are the benefits versus the risk for an abdomen x-ray on pregnant patients? So that's what you will have to decide. Me personally, I have not taken an abdomen x-ray on a pregnant patient. I've had, let's say, chest x-ray taken on a pregnant patient, but not an abdomen x-ray. So just reach out to the doctor to see, hey, is this a mistake? Do you know that the patient is pregnant? So you can always just reach out. Now we have respondeat superior. This means let the master answer. This is a legal doctrine that makes employers liable for the actions of their employees when those actions are done within the scope of their employment. And then you have res ispa loquitur. This means the thing speaks for itself. A legal doctrine that states the cause of negligence to a patient is obvious, such as sponges left inside of a patient during surgery. So that's obvious that the sponges should not be in there. So that would be an example of that. And then you see the x-ray image and the white arrow pointing to the sponges. So let me highlight that for you just in case. Oh, well, sorry, it moved on to the next slide. And then I can go, but never mind. But you seen the white arrows pointing to it. Okay, now we have restraints. So this is used in healthcare setting to prevent patients from causing injuries to themselves or others. Examples of patient restraints, you have belts, jackets, and hand mitts, like the picture to the that's above me. A physician's order is required to restrain a patient. Side rails may be up or bed alarms to prevent patients from getting out of the bed. So whenever I do return a patient back to their room, I always make sure that the bed is in the lowest position and I have their arm rails up, even if they are not a fall risk patient or even if they're not restrained. I just still do that. And then it's been a lot of times where patients have like a bed alarm. So before you take the patient, out of the room and away from the bed, is the alarm would go off. You just need to contact the department station, the nursing station, just let them know, hey, I'm in the patient's room, trying to either sit them up for an x-ray or get them in a chair for a better x-ray picture. And then you have physical restraint, which is applied to the wrist, ankle, and waist. And then examples is do not use a sheet to restrain a patient, especially if you are trying to help them hold still for an x-ray. That is like a restraint that is not medically ordered or approved by a physician. And then do not use your hands or arms to restrain a patient for an x-ray. So if you are taking, let's say, a foot x-ray on a patient, and you have to hold their leg down so that they do not move because they're moving a lot, they're mentally altered, they do not understand what's going on. You went to this room 10 times, and now that you're in there by yourself or with another tech that can help you, do not just hold down their leg against their will. That's restraining them. And then we have acceptable restraints that we use in radiology. We have sponges to help patients hold still for a hand, finger, or spine x-ray. Sometimes you use the sponge for the spine x-ray to get like a good oblique, sometimes a good lateral. And then you also have the pigostat device to help immobilize babies for a chest x-ray. This is going to reduce unnecessary radiation exposure to the child. Some kids and babies are great with x-rays, some probably just need just to be held still a little bit better. So this would be a good way to just hold the patient still or the baby still. So acceptable restraints are used in radiology to prevent motion. This is going to prevent patients from moving during their exam. Now we have manipulation of electronic data. This is to just say be careful whenever you are manipulating patients' information. This can be used against you in court, especially if something comes up, like let's say cancer, a missed fracture, a missed cancer, a misdiagnosis, because you manipulated the patient's chart or images by either cropping something out or adding something in at the last minute or taking something away. Maybe you or someone is doing this to cover up for something bad that just happened or something that you are trying to prevent from happening. So do not crop off a patient's body anatomy in the x-ray image. Make sure that you are collimating during the x-ray exposure. So now we're going to talk about the importance of documentation. Accurate and precise documentation is required. Document any patient falls, if the patient is at risk for falling, if the patient is unstable during the x-ray exam or dizzy, if the patient moves a lot. This will help the technologists who have to come behind you or take the x-ray in the future. Document any allergic reactions to barium, any iodinated contrast. Documenting this information will allow this to be placed into the patient's chart to warn other medical personnel of the situation. You want to make sure that you are documenting if a patient refused an exam, if the patient could not hold still, um, what is the reason why the patient couldn't hold still? Are they in pain? Are they altered? Are they nervous? Do they have dementia? Do they have Parkinson's disease? All of this information is important because it shows the radiologist that you tried, but you just was unable to obtain like the best images. You want to make sure that you are documenting the medical history for why an x-ray was ordered. If the doctor wants you to take an x-ray of a patient's wrist or knee, don't just put fall. Put patient fell down the stairs 2 months ago. Patient is complaining of pain on her left side or the right side. You can use medical terms lateral, medial side. You can also document reasons for exam delays. If you went to a patient's room and the patient just got there, the nurse is taking vital signs, lab came in for lab work, now the patient have to go to the restroom for a urine sample. All of this can be documented because it lets, the doctor know that you try to get to the patient. The patient just occupied right now with other tests. So I always say just document because it's important to document. Don't try to hide anything. You would just be better off if you just documented everything and was just truthful. All right, that's it for this presentation for part 2. Please give the video a thumbs up or leave a comment if you would like for me to post a part 3 for patient care. I will try to remember for the x-ray videos to link the playlist in the description box so that you can get to the videos quicker because I just throw a lot of things on my channel. I have things about mammo, CT, some things about MRI, some daily life vlogs, some work life vlogs. So I have like a variety going on my channel and I want you to get to the videos a little quicker. So just try to remember to always check the description box. I'll try to leave the playlist in there if you cannot find it. Searching playlists on my channel. But other than that, thank you all for watching and I hope to see or hear more information in the comments from you. Bye.